Hey, what is up, my dudes and dudettes? I gotta make this quick because I gotta be on video chat with my therapist soon. Girl's got a panic disorder. It's called generalized anxiety disorder. And because I've gone through so much about PTSD, I tend to freak out a little bit. I overthink everything. I'm an empathic person, so I also feel what other people feel. But I find that a superpower that I'm empathic, but whatever. I did a video a few days ago talking about the aftercare of when you go through extractions. So this is part 2. Yes, for the dude out there that couldn't wait for part 2, it is here. If you guys like my channel, please subscribe and click the bell and click all if you like my channel. If you don't, then don't bother. Also, if you like the videos, guys, like it. Watch the videos fully through because you also miss giveaways. I just want to help people and I want to make a difference. So if you come across this video and you're not a denture wearer, but you know people who are, or have tooth extraction issues, this is for people with even just no dentures. It's for extractions, implants, doesn't matter. I got you. So share this to people who you possibly can. Remember, guys, the more people like interact with me, I'm going to want to do videos. It's not about like views and all that. I feel like if nobody watches me, I'm not going to want to do videos because who the hell wants to watch me? So that's how I look at it. I think most people look at it that way. So I did the part 1 when I broke down like literally 1 through 6 on my page that my dentist gave me of extractions. Now I love how they don't give you denture shit. This is what I'm here for. I'm here for the denture shit. I'm here to tell you how to do it and break it down New York style. People that get annoyed by my accent, honey, I used to be thicker than this. I moved upstate, went country. So that's been interesting, but I lost a lot of my accent. It's only when I'm angry it comes out. It's not pretty. I've been trying to work on it. It's getting there. But I don't judge people for how they are and what they speak. Please do not do that for me. I get hate all the time, and I don't understand if somebody's a good person and wants to help the world. Why the hell are you hating for? How about you join the good and bring the good to other people and share it? Because the more good that goes out is the more good that comes into you. And I totally believe in karma. So let's get this. Oh, before I forget, I have a Facebook, Heather Be Denture Diva, which I've reorganized, by the way, because when I've been sick and clots and blah, 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 it spammed. So I've been fixing it, whatever. And I actually hit 1,000 followers. So thank you guys for that. And I'm going to be doing separate lives now starting this week with that. I don't go on Instagram much. Maybe if people watch, I guess some of it I would. I don't know. I don't go on. Don't message me there. Message me anywhere else but there. Because I feel like Instagram's a mess. But okay, we're moving on. People like relatable. Operative care after extraction. So I'm going to read it to you guys like I did last time and then I'm going to break it down. So it says, after tooth extraction, it is important for a blood clot to form. Did I not just say that in part 1? Part 1, you need the blood clots. There have been people that are like, Heather, there's a dark thing inside my socket. I've been trying to get it out. I'm like, oh my God, don't do that. When you look in the mirror and you see dark red, whatever colors, that's it, you want them. Because it covers the nerve, it covers all that stuff. It prevents dry socket. You need it. You need it. You need it. Don't make me spaz out, guys. Don't make me spaz out. And that's how the healing process begins, which we already knew that. Thanks for the notice on the paper. That's why we ask you to bite down on gauze for 30 to 40 minutes after the appointment, which I do it longer than that, because you want the bleeding to stop to form that clot. You need that. If the bleeding or oozing persists, place another gauze and bite firmly down. Not so hard, guys. I know we're numbed up most of the time for people that get Novocaine. Don't press freaking hard. You're going to trauma. Don't do that. You're going to bruise it even more. So when the Novocaine wears off, you can be in hella pain. So just bite down just to where it meets and you're pressing down and change out the gauze. I would change out the gauze every 10 minutes in my eyes because it's just clean. Use sterilized gauze, please. I went to the store and I got a box. They don't give you enough at the dentist. So after the blood clot forms, it's important to not disturb it. In my words, don't piss it off, bro. Don't be drinking out of straws, but y'all know that. I say wait 2 weeks before you drink out of a straw. It's not a big deal. It's not the end of the world. People are like, oh, I need my straw with my iced coffee. No, honey. You need to put your mouth on it and drink it like a normal person for 2 weeks. Even I thought it was hard to not have the straw because I normally go to Dunkin' Donuts, a VIP member. I like coffee. But you can't. You're going to piss it off. Do not brush your gums. This is the most important information I can give you. Not yet. Not yet. The salt warm water that you're going to be doing 4 times a day for the first 2 weeks, yes, do that. I use sea salt. People ask me what salt I use. Sea salt. You don't need to get bougie and use Himalayan. Sea salt. It's great. It heals beautifully. I mean, quick too. So if you do it 4 times a day, do that, because it'll keep disinfecting. Do not brush your gums yet until 1 month, and I'm gonna tell you why in a second. Because you're gonna really, what is with the breaks? Hear that? Every time I do a damn video, break. What time is it? I gotta leave you guys soon and pause this, so give me a second. So do not disturb, dislodge the blood clot. Do not rinse vigorously. I told you guys before, shake your head. Just go like that. Do not swoosh, because that can lift the blood clot up or dislodge it and dissolve, and that'll suck. I'm not going to ask why they put this word in here. We're going to skip it because that's not appropriate. It says, do not suck on straws, do not smoke, do not drink alcohol, or brush your teeth for the next extraction, by the extraction sites, blah, blah, blah. So if you get 1 or 2 teeth, you can't brush the rest of your teeth and do all that. But if you have like extractions, like, you know, half a mouth or full mouth extraction, avoid it. Salt warm water will do it all for you. Smoking, now here's the deal. I'm a smoker, and people like how they're breaking down for real. For the first couple of days, I really do not advise you to smoke. I mean, I think I did, but you got to understand, I didn't puff on it. So that's why they say not to smoke. Because when you suck on it, you're actually doing the sucking motion like a straw. That's why they want you to prevent that. I didn't really suck on it at all. I just put it close to my mouth and just breathed in normally. So, I mean, that's the safest way to do it. Other than that, don't smoke. People, stop vaping. You suck harder with vaping. Please stop. First of all, it's bad for your health. I know. Kettle black, get it. But the amount of suction you need for vaping, you just hold off. Just hold off, bro. Trying to see what else is super important. After tooth extraction, you may feel some pain. I know y'all making the same face I am. Some pain? Sister. When you start praying to every religious figure that, whether you're religious or not, you know that's pain. I'm like, yo, dog, God, we need to have a conversation because I can't do this. My top, I didn't know what to expect or what to do. And I figured it out and nailed it for my bottom, except for my, you know, denture being embedded into my jaw and all. But it is a lot of pain. So when you have 1 or 2 teeth, no, it's not a lot of pain at all. It's actually, you feel better within a day or 2. When you have all of it and they're yanking and pulling, and that's a lot of trauma. Ibuprofen before and keep going with it. Set your timer, be precise with it so you have some control over the pain. Like, I literally have therapy in 5 minutes video chat. So like I said before, it says here, I normally have a very low dosage of pain meds that I take, which don't fucking work, by the way. So my doctors get mad because I don't really take it a whole lot because it doesn't work. So my dentist was like, Heather, you know the drill. Do you, girl? And he didn't really give me anything, which I'm cool with because it wasn't going to work anyway. I'm a firm believer that when you get this done, the only thing that will work, don't even do a lead because you can only do it once every 12 hours. You're going to hate yourself for the next like 9 hours if you do that. So don't. Ibuprofen. And they're going to tell you between 600 to 800 milligrams if you're not allergic. I mean, you could do the shot like I did, the allergy shot. And I did because I'm allergic to ibuprofen, I did a different anti-inflammatory. But pain meds are not going to work because it's an inflammation pain. Inflammation pain, you need ibuprofen. So, and I mean, guys, set your alarm. Don't skip out, oh, because I fell asleep and I slept or whatever, that, you know, I didn't keep up with the dosage. Well, that's when the inflammation can sneak in and then take over, and then you have no control. Control, it's all about control. I swear to Jesus, it's all about control. Control. That's all you need. So people with immediate dentures act as a Band-Aid. That's why they actually, some dentists are like, oh, well, you don't do immediate dentures. That's because you're old school, boo-boo. Immediate dentures act as a Band-Aid and protect your sockets, especially when eating. Nothing gets in it if you don't have dentures, which is rough. I have state insurance too, but I was blessed to be able to pay off payments and be able to do all that, which I'm very lucky for that. Um, but without them, you can get anything stuck in those guys. And you don't go digging food out, please. When you salt water rinse, when you shake your head, it'll come out eventually. Please do not dig at the blood clots. Baby your blood clots like it's a newborn baby. That's the best advice I can give you. All right, guys, I'll be back. All right, guys, sorry I'm back. Yeah, I had to talk to my therapist, spoke to him for 30 minutes of what I've been going through, new meds and stuff, but that'll be a whole other different video I chat with you guys. So I was reading a little bit more while I was waiting for him to get on the line. Okay, so here it says, if possible, take 1,325 milligrams of Tylenol and 1,300 milligrams of ibuprofen at the same time every 4 hours as needed for pain. I want to state something. Tylenol is BS for pain. I think we can all agree that it's like a tic tac. It doesn't do shit. So that's a fact, bro. They do have the combination, yes, even with pain meds. Look at Tylenol and what is it? Oxycodone, I don't know, whatever. Separate, it doesn't do as good, but combining them makes it a better pain management. I learned that years ago, which I thought was cool. I find science and like health fascinating, maybe because I'm a mess. But I find the human body just fascinating. Anyway, moving along. When it comes to teeth, Tylenol don't do shit for it. And you got to be careful. Do not exceed over 4,000 milligrams of Tylenol a day. So, say if you were to take the extra strength, two of them is 1,000. You do that 4 times a day, that's really exceeding and pushing your button. Because they used to say 3,000 is the max. But sometimes people need 4,000, but it can destroy your liver, guys. It can. Please don't. Like, I worry about that. Same with ibuprofen. Put something in your stomach, whether it's a smoothie, whether it is pudding, whether it doesn't matter what it is, whatever it is. Coat your stomach before taking ibuprofen. Even a glass of milk is cool because ibuprofen can cause stomach ulcers. It can cause harmful stuff. There's a label warning on it on every box ever created. Um, so yeah, guys, definitely be careful of the usage. But ibuprofen is so much better for, say you're getting your wisdom teeth out. I had mine out at 18 and it was painful. Those teeth are like embedded into the back jaw, man. Thinking about it, I feel it. I don't want to go there. But ibuprofen, we have inflammation pain. When you have one tooth out, you don't get a whole lot of pain. I mean, some people, depending on how severe, they had to dig, they had to do all that, blah, blah, blah. But one tooth, in a couple days, you'll be good. Full mouth extraction takes a couple of weeks. And the struggle is real, dog. I don't care who you are. Yes, it's going to be more painful for denture wearers because if our denture is protecting like a band-aid and the swelling, the denture kind of like it is tight. If your dentures are loose during inflammation, your dentist did not do your dentures correctly. Because if they're loose at the fluffiest, most painful inflammation time, that'll be like a week or two, then those dentures are going to be falling out your mouth by week 2. No, if your dentures are ever loose the day of extractions, they need to redo them. Facts. Don't let them do soft reliner that will rip out clots. It's messy with blood, ew. And some dentists make bad choices. I can't say most of them, but some of them do. Um, Protect the sockets as much as you can. Baby the crap out of them. They are your child for that moment. All 32 if you got them all done at once, 14 up top, 16, whatever, doesn't matter. Baby them. You want to keep your clots. You want to be gentle as possible. Please be careful. And when you take out your dentures, I would say the first few days. Now, this is something I want to discuss. I want to discuss it here. Biofilm. Nobody spoke about this anytime I was in the denture community before I was on denture, I was on YouTube or anything like that. Nobody spoke about this because nobody knew about it. Now I deep dive. We all know I deep dive through the land of Google, through every freaking denture site. I go deep down. Now that filmy stuff that tastes like shit, that's like blood, bacteria, and it's just grossness. That's just gross. Can't even explain it otherwise. It's called biofilm. I did not make up the name. It is the name of it, which even when I was talking to I want to names, but some dentists or whatever, even YouTube, that they didn't even know about it, which was shocking a little bit because I figured dentists should know about it. But I guess because they don't learn much about dentures. which that needs to change. That absolutely needs to change. I would say more than half of dentists don't really know much about dentures. You might know how to make them, some of you not well, but you don't know what dentures go through. Take the time out to listen to your patients, to talk to them of what they want, what they struggle with, how you can help them. I can't be the only one that knows how to research. You just deep dive. Um, but the information needs to be out there. When dentists say, "Oh, just look it up and find it yourself," they pay you to do a job, honey. You're supposed to help your patients. You're a doctor of the mouth. That's your job, is to help your patients, not say, "Have a great day, bye." That's not how that works. So I really hope the dental community gets better. I really think they do. Like some dentists, from what I've seen, like even online, they're amazing. They're absolutely freaking damn amazing. But from what I hear of other people and what I've seen, I just hope it gets better one day. And for the future people, it needs to get better because it sucks. Why should somebody have to research if they paid you thousands of dollars for dentures? You are a doctor of the mouth, teeth, gums, all of that, and you're not giving any information out. Like, I feel like the patient care needs to get better. Like, you take 2 minutes to speak to your patients, you run on to the next patient. You don't even take time to talk to your patient who paid you thousands. And I think that it's based on respect. We shouldn't be looked at as dollar signs. We should be looked at as people, just like they would want to be treated that way. But the gross, icky shit is biofilm. Make sure you use salt warm water, rinse your mouth 4 times a day. It will go away within a few days. It does. Some people get it worse than others. I've noticed that people with infections definitely do. They get it more, and like say periodontal disease. So it's a body cleansing thing. It'll go away, I promise. But I hope this video helped you guys. I love you. Please stay safe. And thank you guys for looking out and watching my videos. I truly damn appreciate it. And don't stop wearing your denture. Keep wearing it. Keep them in your damn mouth, please. The only way for you to get used to something is if you use it. And if you need help with talking with dentures, it's a whole other video. But singing actually helps the most because you emphasize and you have more room and space. Also, know when gum shrinkage happens, the denture goes up, this one goes down. You have more space in your mouth to talk. It's just the beginning that makes it a struggle. It will get better. I love you guys. Later.